Healthcare around the world is being impacted in unprecedented ways. But how exactly is maternal care being impacted with what's happening?
Sure, of course, you know that during public health emergencies, it is quite common to see that human and financial resources from health programs are diverted to respond to outbreaks. I think in this case, we must be very certain that during the pandemic, maternal and newborn health be prioritized. One thing that is quite important is that women have access to safe birth, and we can ensure that the continuum of care and postnatal care with screening tests according to national guidelines and standards are especially taking place.
Right. I don't want to take this term you mentioned here, safe births, for granted and assume that everyone who's watching exactly knows what it implies. So I'd like you to explain to us, especially during this time, what that means.
Yes, I think that really does imply that there is the ability for a woman to receive the type of care and treatment necessary in order to ensure that she's able to give birth in a safe circumstance, if that helps answer the question.
Right. And just about how that's being made difficult is, of course, the fact that there is a danger in many healthcare facilities that there is a rising rate of infection amongst doctors, nurses, midwives. Given that, what do women do? Because that's the main panic surrounding if their delivery is due soon. Should they even go to the hospital? This is one of the most frequently asked questions on social media, on various sites. That's a major concern. What do you think is the consensus on that?
Yes, so there's no current evidence of the adverse effects on pregnant women from COVID. With that said, it's important that infection control measures be taken into consideration at hospitals. And I believe that this is occurring in many places around the world. These decisions should obviously be made in accordance with with government.